If you're dealing with low back pain, it can be one of the absolute worst things and it can really wreck your practice. So let's show you a lot of techniques that you can do that's really gonna help open up your low back, really help you move better and get rid of some of that low back pain. What you're gonna need for this is you're gonna need a larger ball, something about the size of a softball. I'm using a hypersphere here, but like I said, if you go get a softball from a sporting goods store, it'll work just as well. Now, first muscle that we're gonna get into here is our QL, quadratus lumborum. It sits right here underneath the meat of our low back. So how we get to this is we gotta kind of come in from the side. We can't come straight back. There's too much stuff laying over the top of it. So make sure that you're coming in from the side into that spot right there where I have my thumb. So ball goes right there. And then what you wanna do is you want to lay down on top of it, right there on that spot, and then roll back and forth over that spot. Now, if you want a little bit extra stretch, what you can do is you can pull your knee up to your chest like that as you roll back and forth through there, and that's just gonna give you a little bit extra pressure onto that muscle. Do both sides, and you're immediately gonna feel a lot of low back pain release. Now, the next spot to go to is in the hips. So we have two spots in the hips. We have the glute med, which is here on the side, just above the bone. So if you feel that hip bone there, you're going to come up above it and you're gonna feel a soft, fleshy spot that you can kind of sink into. That's glute med. The other one's gonna be piriformis, which is underneath your glute back here. So I'm gonna start with on the side. Here with our ball, right there onto our side like this, and then roll back and forth and side to side on this. So make sure that you stay off the bone when you do this. Stay in that soft portion as you go through it, but just get through all of those areas like so, and then spend about 30 seconds to 1 minute hitting all of those tender spots. Now, the next spot that you want to go to, piriformis, we're going to sit down on top of the ball like this. We want to have the opposite leg bent up like so, the other leg straight out. Roll side to side here until you kind of hit that spot on the back side of your leg here, and we're just going through just like that. Now, the next level of this stretch is going to have you pulling this leg up like that, and then going back down. Pull up and go back down so you can kind of pin that muscle down, stretch it out, and you can do 15 to 20 passes, 30 seconds to 1 minute. Just focus on some nice, slow, deep breaths, because this can be quite tender as you go through there. So try and relax into it, do both sides, and then that low back pain is going to feel a lot better. Now, I want to then finish up with a nice low back decompression stretch. And what we're going to do here is we're going to stretch into our hip flexors. So if you remember in our posture assessment, if you were in that anterior pelvic tilt like this, you want to make sure that you can open up those hip flexors so that you get into that neutral pelvis. So here, we're going to bring this leg up. We're going to stretch out this side. So I know a lot of you stretch out your hip flexors like this here, but I want to slow this down. We want to bring it back, and we're going to go through this piece by piece to make sure that you get the most effective stretch possible. Now, what we're going to do here is we're going to pull our pelvis backwards. We're going to rock it back. We're going to kind of tuck our butt under. We're going to squeeze our butt on that side. So we're squeezing that glute. So you're already going to feel a stretch here in the front of your hip for most of you, unless you're very, very flexible. Then what you want to do is you want to keep that glute squeezed and push forward into that stretch about 1 to 2 inches. Don't have to go very far. We just want to intensify it a little bit. Then hold that glute tight. Hold that position, bring your arm overhead like this, twist open, and bend away. So you're just kind of reaching to the ceiling, and you end in this position right here. And then what you want to do is you just want to take 10 deep breaths in and out, really focusing on relaxing. From the front, it looks like this. We're here, we tuck our butt under, we squeeze that glute and push forward. Bring the arm up, rotate open, and then reach across your body. We're reaching to the ceiling, and we're really just decompressing our spine as we go through this. We do that on both sides. And then we're gonna notice that our back bend, that extension back pain that you may have been feeling, is gonna open up and feel a lot better for you. Now, on the other side of that, we wanna get into our hamstring. With the hamstring, we're going to stretch out the front leg like this. Now, for the hamstring, it's just kind of the opposite. This time we rock our pelvis forward, we kind of arch our back, and then what you want to do is you want to pull your butt backwards as you fold forward, keeping this neutral spine. Don't just fold forward like this. Make sure that we're keeping that arch. We're like that. Our knee is going to stay slightly flexed because we want to feel that stretch here through the belly of the muscle. We don't want to be feeling anything in the back of our knee. If you lock out the knee, you might start to feel a lot of stretch back here. That's not really what we want. We want to be here. We want to feel it right there into the belly of the muscle like that. And then again, 10 deep breaths, and we're just going to sink in as our body allows it. So here, and just try and push yourself a little bit deeper on each exhale. Run through all of that. Low back pain can be quite complicated, so there's a lot of little things that you might want to go through. See what works for you, see what doesn't necessarily work for you. Once you find your things, your low back pain is going to disappear very, very quickly.